Do you want to maximize your success with NCUA? Join Mark Treichel as he shares with you the insider's view on passing your exam with flying colors. The With Flying Colors podcast is sponsored by Credit Union Exam Solutions by Mark Treichel. If you would like to work directly with the Credit Union Exam Solutions team and receive support to optimize your results with NCUA so you save time and money, visit us at marktreichel.com to find out more.
This is Mark Treichel with another episode of With Flying Colors. This is a short take, and last week on LinkedIn, Sam Brownell of CU Collaborate announced that he was thrilled to announce that CU Collaborate is incubating its first CUSO to pursue the best idea he's ever had, and that he has successfully recruited a gentleman by the name of Paul Matsui to lead it. Now, this CUSO leverages credit unions' superior pricing to help patients more easily manage their healthcare expenses. Without going further into Sam's post, the reason I'm doing this podcast is a couple months back, I had Sam on to talk about all things that CU Collaborate does, and he mentioned this idea and was very excited about it, as am I, if it's something he can pull off. I think it would be great for credit unions, great for the healthcare industry, and most importantly, great potentially for your members. Anyway, without further ado, here is what Sam said last month about this for a little bit more details on this exciting new CUSO that he is trying to get up and running.
I have one idea that I think will capture dramatic market share for credit unions. It's ultimately a partnership between healthcare hospital systems, health systems, and credit unions that is focused on making healthcare more affordable and essentially presenting credit union offers to all patients. My wife works in healthcare, and the way I came up with this idea was actually listening in on one of her work calls. They were really focused on essentially the exact things that both its CDFI credit unions are so focused on, which is ultimately creating, now the idea would be healthier, wealthier, and more equitable communities, but greater outcomes for exactly the CDFI target populations, the low-income people and minority groups who generally have much worse health outcomes. I see credit unions as an incredible organization to help people with those problems. Got to think about how credit unions could work with hospitals to do that, and I think I've come up with a very I'll just say what it is. So it's basically debt refinancing at the point of bill pay. So a patient goes into a healthcare provider. The healthcare provider allows an agent of the healthcare provider, in this case, this CUSO that we're launching, to run a pre-qualified soft pull of their credit. We can then identify what loans they have with who, and you can model and figure out what their monthly payment is. And then we can run them through our field of membership decision engine and ultimately underwriting decision engine and figure out what credit unions would offer to refinance that person's debt at a lower interest rate and how much. So really what we're looking to do is how much can we save them a month on their other bills to make their medical bill more manageable to pay? Because if they can't pay their medical bill, then they generally don't do other preventative care, so they won't see specialists, they won't fill prescriptions, they won't come and seek additional preventative care after going and seeing a doctor. And the thing that credit unions will care about a lot beyond just the social benefits is 90% of people go through a health system each year. And so hospitals are terrible at accounts receivable and collections. And so we could take that off their plate, and part of the cost of doing that, basically hospitals will be paying to market credit union offers to basically the whole country, and it will be solving I've talked to a healthcare VC, and it's rare that anyone brings a top 5 problem for health systems to us. And this is definitely top 5, if not the number 1 problem that health systems are facing because of the Medicare, Medicaid. The social safety net is going away, and hospitals are really struggling to figure out how they're going to get paid for the services they're doing. And so if the patient portion, if credit unions can help hospitals collect more from the patient portion of bills, it will make a big difference to healthcare. And through the Affordable Care Act, what hospitals get from federal subsidies is determined on their outcomes. So if it actually does have the impact of changing the health outcomes of their patients, that will even have a greater multiplying effect for healthcare providers. I'm super excited about it. Yeah, and I've already recruited a incredible guy to be CEO of the company too. So it's going to be, I'm the credit union guy. It's going to be a product that we're selling to health systems. So the whole team will be like it'll be a healthcare facing company. And then the sort of special sauce on the back end is credit union, essentially.
And I think I heard you on the front end, you said it's a credit union service organization structure.
Yeah, definitely.
I've got a daughter who's a physician, and occasionally she'll share some stories without going into any specifics. But one of the things I heard you say was if they go in and they don't have the ability to go in for the follow-ups, they don't succeed. There are people who have all the money in the world who don't want to go back in and do the follow-ups, don't want to do what the doctor tells them. But if you put somebody behind the 8 ball where they have to decide whether or not they're going to feed their kids or go in for that follow-up exam, their success erodes underneath their feet because they'd go if they had the opportunities. I think that's an exciting venture you got going there.
Yeah, I'm very excited about that. That's the biggest picture idea we're working on right now. I think that could really change a lot.
Yes, huge impact there. That's exciting. So Sam's excited about it. I'm excited about it. It's a really interesting concept, and I wanted to, since Sam was talking about more details on this, I wanted to go back and give the details that I had relative to it in this short take of With Flying Colors. And I hope you enjoyed it. I hope you'll listen again soon. And if you haven't subscribed, please hit that subscribe button on your favorite podcast app, whether that's Apple, Spotify, Stitcher, Google Podcasts, Amazon Music, or just listening to it on my website. I really appreciate you listening. And this is Mark Treichel, signing off with Flying Colors.
Thank you for joining us on this episode of With Flying Colors. Subscribe on your favorite podcast app to hear future episodes where subject matter experts of all varieties will provide tips on how to achieve success with NCUA. If you would like to learn more about how we assist credit unions, check out our services at marktreichel.com.